We're here today thanks to the hard work of a lot of people in this room, including our governor, our House and Senate leaders, and others who have joined us in making this announcement possible. I would like to thank each of you for standing with us and helping us get to this point. I also want to thank our entire Board of Trustees, as well as Tom Meeker and Rishabh Malhotra for their time and talent and unanimous support in getting us to this point. But the real hero in all of this is our leader, Dr. Neeli Bendapudi. I want you all to do that again in a minute. That's what the script says. While the real hero in all of this is our leader, I promise you she is going to stand up here and give credit to everybody else. But it is her vision, her loyalty and love for this community and this university, and her fearless tenacity that led us to this point. I call it the Neeli effect. She has been the driving force from the start.
This has certainly been a super exciting 4 weeks for you as chair and for all of us. And after about 15 months on the job, I can tell you that this has just been about the kind of pace of being president at the University of Louisville. And I hope that every year we're actually able to create this kind of excitement around something so positive for the community. Before I share our news, I really want to thank each and every one of you that's here today. There's a lot of people who played a big role because this all came up so fast who are not here today, but I want to acknowledge each and every one of you. This is a really important moment in the life of the university, of the city, and of the Commonwealth, incredibly important. There are very, very, very few times in our lives on our human journey when we are together able to take a risk, a big risk, granted, but to do the right thing for the right reasons and to find so much support for it. And I'm so grateful. You will hear some of them called out, but I'm so grateful to this Commonwealth that clearly shows that united we stand. We're living by our motto today. And that brings me to our announcement today. I don't know if any one of you will be surprised, but I really would like you to act surprised for me. In the special Board of Trustees meeting just now, the University of Louisville Board of Trustees voted unanimously to acquire the Louisville area assets of KentuckyOne Health, including the struggling Jewish hospital. The board of KentuckyOne Health's parent company, Common Spirit Health, voted in support of this transaction yesterday. We hope to have all regulatory and church approvals to be granted in the next 8 to 10 weeks, with a final closing date of November 1. To be specific on the terms of this deal, UFL will be acquiring the company's employees, that's the physicians, nurse practitioners, medical, non-medical staff, and the physical assets, including Jewish Hospital, Fraser Rehab, St. Mary's and Elizabeth Hospital, Our Lady of Peace, Jewish Hospital Shelbyville, and the outpatient medical centers, Jewish East, Northeast, South, and Southwest. The purchase price, yes. The purchase price is $10 million, but CSH is forgiving the university nearly $20 million in notes payable from us to them. In this way, the net of this deal is actually about $10 million in our favor, and we appreciate that. Additionally, we will get about a little over $75 million in accounts receivable and in cash to use as immediate working capital to help with this transaction. You may be wondering, how did we get here? Normally, in press conferences, we don't have such a long monologue from me, but I ask you for your patience because this is so important to so many. We know that the KentuckyOne Health Louisville area assets have been on the market for nearly 2 years. We, like you, were waiting for a private sector solution. UFL engaged in informal conversations with KentuckyOne Health starting in late 2018. And we were in formal negotiations with them since early 2019. Many of you remember that we walked away from the deal in mid-June 2019 because we did not have the time or the ability to identify a suitable partner. At the time, we knew that Jewish Hospital might close, but we expected it to be several months away. And we hoped that that would give us time to transition our services without interrupting patient care. So what changed? Last month, KentuckyOne Health suspended the heart transplant program at Jewish Hospital. This was unexpected and a clear indication that now an out-of-state company was not going to be able to operate the hospital here much longer. Then we learned shortly after that, about August 1, that the closure of Jewish Hospital was imminent, that there would be a deal announced actually tomorrow of sale of the other assets, but that our indications were that Jewish Hospital would be announcing closure and probably be closed in a couple of months. Key faculty have already begun to leave because of the uncertainty around these facilities. And we were concerned that a mass exodus would occur if Jewish Hospital's closure was announced. And that's not just our people. As far away as in Shelbyville, there's so much anxiety about what will happen. So why are we choosing to act? First of all, we are a public university, and I strongly believe that public universities are mission-based organizations, and we must be committed to the public interest and public trust. Our missions are research, teaching, service, and through our clinical enterprise, patient care. Our mission requires us to do what is right, not just for the University of Louisville, but for the people that support this institution, for all of the citizens of the Commonwealth, and all those who rely on our university as a source of economic and personal growth. Let me put it very simply. There's a lot more here, but I'll just cut to the chase. Jewish Hospital is just too important to this community for us not to act. Let me give you some numbers. These are sobering statistics. The Louisville area KentuckyOne Health system sees more than 2 million patients a year, has nearly 40,000 emergency room visits, and employs more than 5,500 people. Those are real lives that would be affected. We could not sit idly by without at least trying to be part of the solution. We know this is a risk for the university. We are doing this because we feel we must. We also do believe we can do it successfully. I've told you many times, when you're flying on an airline, you're told, if you need to save somebody, put the mask on you first before you help the next person. Over the past 15 months, I feel much more confident today about our ability to execute this successfully. So despite the financial woes at Jewish, our confidence is in our leadership team, and there's so many people I could single out. Does this make sense for the University of Louisville to do? We know that it matters to the community. I've told you, just at Jewish Hospital, there are about 3,000 emergency room visits, a little over a month, and about 19% of them need to be hospitalized that day, and there are no beds available here. Why does this make sense for us? Critical role of the university in providing quality care to the community. A town-gown relationship is something we take seriously. First, our education mission. Right now, we have about 60 residents who are at Jewish Hospital and count on it for furthering their education experience and becoming the best healthcare providers they could be. Research. We are so proud of the research that's happening here. Oh my gosh, I see at least 2 or 3 of our bright spots here. There's so many. If I missed you, don't take it amiss. I love you all too. So I see Dr. Susie Harkema. I see Joseph Niemat. I see Aruni Bhatnagar. Among the many, many people, it's just they're perfectly lined up there. I can tell you that they will tell you that without these facilities, without access to these facilities, the important work they are doing is at jeopardy. And that means our research standing as an R1 institution is at risk. Patient care. This is incredibly important to us. And we are concerned about the financial impact. We are only as healthy as the Commonwealth is. And a payroll of about over $300 million is what we are talking about in this acquisition. But none of this would have happened if we didn't have the right partners. We told you from the get-go, given the deep losses and the lack of private enterprises stepping up for this, that this is a risky proposition. And we did find the right partners. You will hear about many, many people who played a significant role, but there are a couple that I really want to call out. This was broad, bipartisan, public and private sector support. In order of how these meetings happened, this is serendipity. On July 25th, that was about 3 weeks ago, tomorrow, I think, I had a scheduled meeting with Senate President Robert Stivers. And it was a casual conversation. It was supposed to be to talk about preparing me for the upcoming budget session. And we started to talk about what was happening in the healthcare arena that led to conversations with other leaders. So Senator Stivers is not able to be here today, but please, all of you recording this, make sure you acknowledge that I thank him for his leadership and vision. But even with that, nothing would have happened, candidly, if it hadn't been for a meeting with Governor Bevin on August 1. And that's how fast this all moved. And Governor Bevin and his administration, I know they don't all want to be called out, and there are so many people, but certainly the cabinet secretaries, Brinkman, Serene, Meyer, thank you all so much. But the governor, in our conversation, talked about how we had waited and seen if there would be a private sector solution possible. But he said, failure is not an option here. There are too many lives at stake. Thank you for your commitment to support the $50 million economic development loan that will allow us to keep these more than 5,500 jobs in the Commonwealth and continue to provide quality care to our citizens. One more thing I want to say is that part of it is a forgivable loan. And what I appreciated about the entire leadership, I will walk through the rest of them in a minute, is that the conditions were not just about retaining jobs, but that we retain jobs for Kentucky residents. And the other condition, another path, was that we improve the quality of health care in West Louisville and other underserved areas, West Louisville, South Louisville, other areas. So I really appreciate that commitment. Speaker Osborne, thank you, sir. Thank you so much. And I want to say a special thank you to the Republican and Democratic leaders, including Minority Floor Leader Rocky Adkins in the Kentucky House of Representatives, for your thoughtful consideration. Your letters of support, your words of support really were key for our board in getting over the hurdle of how much risk we were assuming. This was public and private partnership. We were challenged for the $50 million loan to find private sector philanthropic support. And I want to say a special thank you to two foundations. One, to the Jewish Heritage Fund for Excellence, and for all of the board members, the chair and the board members. Thank you so much for stepping in to help us to prevent the closure of a facility that is deeply connected to this community and to the lives of both of our organizations. Your $10 million gift makes today possible. Thank you. I also want to say, to the Jewish Hospital and St. Mary's Health Foundation, thank you. We are deeply, deeply grateful. Their $40 million gift will enable us to work over the next 3 years to turn this hospital system around. They pledged $40 million, $10 million a year for the next 4 years. So thank you most sincerely to the chair and board of the Jewish Hospital and St. Mary's Foundation. Almost done. Attorney General Andy Beshear, Metro Council President David James are among the many that have been a source of support. We appreciate you. I am not calling out every name, including those seated near the podium and those in the audience, but I will personally thank each one of you. Before I turn this over to Governor Bevin, who really did make this possible, I want to sincerely thank my team. They have spent days and nights and weeks and months trying to be part of the solution. There are so many, and I'm afraid I won't name all of them, but Jerry Bradley and Mary Ann Mallory for starting to do the investigation into why this mattered, why we needed to step up. to Tony Gansel, Jason Smith, Kelly McMasters, Jeff Bumpus, for your leadership on the Health Sciences campus. Shannon Rickett, Michael Wade Smith, Jake Beamer, Victoria Scholes, all of you, I promise we'll take a power nap this afternoon. 30 minutes is what you get. And my deepest thanks to Tom Miller, Dan Durbin, Tom Hoy, Jenny Davis, who worked so very hard, and there's so many more that I know I'm forgetting to thank. We will have more time to reflect on this as time goes by. And I promise you, I and my team, we will do our best by this community for this trust placed in us. I do hope this brings some stability to so many people who were uncertain about their jobs and to so many patients who were worried about the care they would get. Thank you so very much, and go Cards!
The reason this is a bet that people are willing to make, the reason it's one that we're doing with confidence, the reason so many people who've been mentioned and others who've not even been mentioned were willing to come together on this is entirely because of the woman that just sat down. I'll tell you that right now. Dr. Bendapudi, the confidence and love that people in this community have for you really can't be put into words. And it's been mentioned already by Mary or Neely, I forget which of you mentioned the state motto, but it's true indeed. United we stand, divided we fall. That's what this is about. This is a community asset. This is a Commonwealth asset. This is an American asset, this university that we are sitting in the middle of. And you think about the things that have been done and the level of R1 research that has been done here. And what that is a Carnegie level designation that there's, how many are there? There's not even that many in the United States. Who knows how many? 120. So you think about it, of all the universities in America, about 120 have this R1 level certification or designation as a research university. You think about the things that was made mention about the heart transplants. Think about the first 4 human hand transplants that were ever done were done in conjunction with this university and its team. The kind of things that literally have transformed medicine and academia on many levels in the world have been pioneered and developed and brought to fruition here at the University of Louisville. This is something that we cannot afford at any level. The absolute cost, the opportunity cost, we can't afford to lose this asset. And you are correct. We had many conversations over many years. This has come with a sense of urgency, has been described in the last weeks as we realized that the university was the right solution. But we did have many conversations about private sector solutions, and for 1,000 reasons. Many of which were the determination of the university itself, and I think wisely, that they just were not the right fit. They were not done in ways that were going to give confidence to us that the 5,500 employees and the nearly $300 million in payroll and the 900 doctors and physicians that are responsible for the backbone of everything we're talking about were going to be cared for. We're going to be given the confidence that they needed to be able to put down roots, keep these roots here for the long term. So a lot of conversations, both on campus and off campus over the last couple of years, talking about how we can take care of making sure this is done right. At Jewish Hospital, again, 30-some-odd thousand emergency room visits a year. If for some reason that asset were not here in this community as vibrant or more so in the years ahead as it has been, where were these people going to go? How were the other systems in this community going to be able to absorb that? So this is an investment, this is a risk, as you said, but you know what, I'm a big believer in calculated risk, and this is a highly calculated risk. And I want to thank Mary, you and your fellow board members, thank you, because this was a wise choice, I believe. I think it's good for the university, it's good for the community. It's not just what we've been and where we come from, but it is the passion that you have, Dr. Bendapudi, with your team to make this an increasingly valuable asset in every corner of this community, to provide services in places that they're needed where perhaps historically they've not even been, but they could be going forward. There's so much upside yet to come. Final couple people I want to mention is, again, so many people at the state level. This has been a tremendous collaboration between people in Frankfurt and the university, and this is how this went down. I also want to thank David Osborne as Speaker of the House. They handle all appropriations at the end of the day, And I say this, I mean, the Senate also has to bless off on these, and Senator Stivers and David Osborne had to be at the table, others as well. I know Gerald Neal, I know you've been very supportive. It's in your backyard, obviously. This is where you represent. But I tell you, I appreciate your steady leadership at this as well. But these two guys, Representative Osborne and Senator Stivers, had to step up and had to, on behalf of their respective caucuses, say, listen, we'll have some meetings, we'll have some conversations. And David, you used the exact same term when we were speaking. This is risky, but it's calculated risk and good risk. And I applaud you all for doing this. It couldn't have happened. It literally could not happen without the support of our legislature. I also want to thank, there's been several people who've been thanked here. Economic Development, Vivek Serene is here, Adam Meyer, the Cabinet for Health and Family Services. But I truly want to single out a man without whom, in addition to Dr. Bendapudi, this literally would not have happened, and that's Scott Brinkman. Scott Brinkman is an amazing guy. I will end with this, but I want to say this. Some of you know him because he was a state representative for many years, one of the finest legal minds in our state, and a very successful private practice attorney for many years. There are very few people in the entire Commonwealth of Kentucky that bring his level of acumen, his level of drive, his level of understanding about how disparate pieces are woven together, and his willingness to find a solution, literally to will this to fruition. And between Scott Brinkman and Neely Bendapudi, the odds were about 99+% that this was going to come to some kind of a positive resolution, and I am grateful to both of you. United we stand, divided we fall. Thank you.
Thank you, Governor, and thank you for your leadership on this. U of L and Jewish Hospital have been leaders in the healthcare community and in medical innovation for generations. The thought of the loss of Jewish Hospital is immeasurable. The economic toll is pretty readily identifiable. As has been mentioned, 5,500 jobs, hundreds of millions of dollars in payroll. Each of those individuals, most of those individuals anyway, living here in Kentucky, paying taxes in Kentucky, certainly spending their dollars in our communities. The loss to the quality of life is less measurable, but certainly no less significant. And the historical significance. Let's think about the number of people that have, men, women, and children that have traveled here from all over the state, broken, only to return home to their communities, to be productive, to continue to contribute to their economies and to their cultures. It is immeasurable. But instead of thinking about Jewish Hospital in the past, let's think about it in the future. A future with a partnership that is more efficient, with one that has lower overhead, that is streamlined operations, and one that refocuses its efforts on medical innovation. The University of Louisville has presented a viable plan, a $50 million loan from the Commonwealth that provides accountability, it provides transparency, and it provides assurances not only to this institution and to the Jewish Hospital, but also accountability to the taxpayers of the Commonwealth, which is equally important. None of this would have been possible without the renaissance that is being led by President Bendapudi and the Board of Trustees that is truly transforming this institution and inspiring confidence throughout the state, but also in the legislature. No good legislation happens in a vacuum. Bill Request 290 will be filed in the coming days that will provide for this transaction, but it cannot happen by itself. When I first heard about this now about 2 weeks ago, my immediate response was this cannot and will not happen without a bipartisan and bicameral solution. And immediately I reached out to Leader Atkins, House Minority Leader, as well as Representative Joni Jenkins, the House Minority Whip, and they understood and appreciated the urgency and the importance of this issue. And as I was just talking to Mary, she said, "I can't believe how fast y'all pulled this together." And my response was, "We don't. We don't do things this quickly in government. But there are certain times when the urgency requires it. And for those of you that that follow the legislative process. You know that I am reluctant to sponsor, in my role as Speaker, I'm very reluctant to sponsor legislation. But it is my pleasure to put my name on this piece of legislation. It will be pre-filed with the support of Representative Jenkins and Leader Atkins, and it is my pleasure to do so. So Dr. Benapudi, thank you for everything that you've done in this leadership role.
So I'm really glad to be here. I'm really glad to be here and as the representative from the Kentucky State Senate, and to celebrate that this acquisition will combine the medical strengths of KentuckyOne physicians with those of U of L into one very strong system. This acquisition opens doors for the U of L Medical School, providing its students and residents with even more opportunities, more venues, and more physicians under which they can train. It will increase our ability to secure more basic and applied research dollars to our community, and it will lead to increased employment opportunities in Louisville and our surrounding counties. Final thought, I will work with my colleagues in the General Assembly and make sure that they understand the benefits of this proposal, because there truly are enormous benefits of this proposal, and manage those risks associated with taxpayer dollars accordingly. We must be good stewards of taxpayer dollars, along with seizing these opportunities when they present themselves. And so my hat's off to the individuals that pulled this together in such a short period of time, the leadership that Dr. Benapudi has shown, that Governor Bevin has shown, Speaker Osborne, and President Stivers. It's really, it's been a tremendous endeavor, and I look forward to working with Speaker Osborne to move this bill through the General Assembly when we convene. Thank you.
Good morning. First of all, Dr. Benapudi and the University of Louisville, I want to take my hat off to you for the leadership and the stepping up to the plate dealing with this, something that really needs to be done. I think the governor said it well. Governor Bevin, when he says this is something that basically has to be done. But I want you to think for a moment, because I think it's all been said here, that several things are playing out here that are really extraordinary, if you think about it. One is that you have both sides of the aisle in the legislature, all the way down through those who are in the healthcare profession, as well as those that affiliated with the university, coming together in a short period of time. Forget the time part, but coming together is an extraordinary thing. And I think we all agree that this is something that really needs and has to be done. That's one. Two, you have the fact that you have individuals, how this plays out in their lives. We talk about the 5,000 plus or 5,500 plus employees that could be affected or would be affected if this was not successful. Think how that plays out in their individual lives. And then three, think about what happens to the Commonwealth when it's in a position where it's not providing the services and the programs that some of us may even take for granted, but others rely on in many instances in life and death situations. So this is an extraordinary event that's taking place here. I'm just delighted to be a part of it and delighted to give my support to it. And I want to congratulate all of those that have been involved in this. And I bring, as an alumnus of the University of Louisville, a special pride in the actions being undertaken here. And thank you very much.
Good morning. I am very proud to be here today and proud to represent the University of Louisville right here in District 40. I'm especially proud today of the way the university has stepped up, especially in recent days and given this very short time frame, to save critical healthcare services for our citizens. This is a good investment. We've heard the word risk used by a lot of our speakers, but I'm very glad that the university and Dr. Benapudi and all of our leaders here today have viewed it more as an investment in our community and our state. It's the right approach to make sure that our vulnerable patients continue to get the medical care that they need. And it's one that will preserve much needed jobs and facilities in our community. These facilities, and I'm also proud to represent in particular St. Mary and Elizabeth Hospital, which has a long and proud history of serving the residents in my district. Many of these residents grew up knowing that they could count on the community hospital to provide the best care possible for their loved ones. Economically disadvantaged residents make up a significant amount of the patient count at Jewish Hospital and at St. Mary and Elizabeth. That's why these hospitals are so crucial. These facilities are important to the communities they serve, and they are a source of community pride. I want to thank our leaders in Frankfurt, including my colleagues who will work to help bring this initiative to fruition. And I would personally like to thank Dr. Bendapudi and the university again for stepping up to preserve these vital healthcare facilities and for their commitment to our community. Thank you.
Well, hello, everybody. You know, for 2 years, countless people in this community have been walking around with pits in their stomach, thinking, what is going to happen to our beloved Jewish hospital, St. Mary's, Fraser, Our Lady of Peace? What's going to happen to all the wonderful people that have worked here, the researchers, the university? And it's been a tough time to see this fabulous, fabulous announcement for our city today, and the teamwork that it's been required to make this happen, where people came to the realization that we're pretty much at the end of the line here, folks. It's either going to happen or it's not going to happen. And you never know when that's going to take place, but when it does, sometimes leadership emerges. Neely, what you've done, she hates taking compliments. You can see that. That's your worst flaw. You just need to say thank you. Where Neely has rallied everybody, the response from the governor's office, from all sides in Frankfurt to say, you know, this is University of Louisville, but this belongs to the Commonwealth of Kentucky. And when Louisville does well, Kentucky does well. When Kentucky does well, Louisville does well. And you cannot have a great city without a great university either. So today, instead of the city going back and the university going back 5 years, we're moving ahead a decade with this dramatic announcement today. So on behalf of the city of Louisville, I just want to say this is a fantastic day here in our city and our Commonwealth, and just thanks to everybody that made this happen. God bless you all. Thank you.